morning.
Good.
My name is Lisa. I'll be your nurse today. And I'm here to help you understand more about your diagnosis of HIV and how it can affect your health. Let's start with a quick review of what HIV and AIDS are. HIV stands for Human Immunodeficiency Virus. It's a virus that attacks your immune system. Immune system is part of your body that helps you fight off infections, okay? If HIV isn't treated, over time it can lead to AIDS, which stands for Acquired Immunodeficiency Syndrome. AIDS is the final stage of HIV. And by the time your immune system, by the time that happens, your immune system is very weak. That's why it's so good that you're here today, and we can treat the HIV, even though there's no cure, but the medicines control the infection and keep it from getting worse. And you could live a very normal life. It's most likely you contracted the virus through unprotected sex or using a contaminated needle. I'm not here to judge you, just giving you the information you need to feel better and ensure you don't unknowingly spread the infection. When your immune system isn't working correctly because of HIV, your body has a harder time fighting off infections and diseases. These are called complications. Pneumonia, TB, and oral thrush are infections that can be very serious if you have HIV because your body's immune system isn't working very well as it should. Some problems can happen while the HIV multiplies in your body, such as fever, fatigue, swollen lymph glands, diarrhea, weight loss, shingles, or pneumonia. It's essential to know when to call your doctor if the fever doesn't go away, if you have trouble breathing or a bad cough, if you see any white patches in your mouth, or even feel confused. They're warning signs. These are warning signs of complications, and you should never hesitate to call us. I know you're probably worried right now, but let me give you some information.
Not really.
Let me give you some information about the medication you will be taking. Antiretroviral therapy medications called ART or ART are common to all that have HIV. It's a mix of 2 or more medications, giving the best chance of lowering the amount of HIV in your blood. This pill is taken 1 time a day. You must always take your medicines as prescribed and don't miss any doses, okay? This will keep your immune system strong and lower the chances of getting an infection. I'm going to give you some pamphlets and to read at home. And I know this is a lot of information to take in at once. I also suggest you attend the HIV group we have in this hospital. It has helped many patients with your exact diagnosis. Do you have any questions?
Yes. Will I get this disease?
You already have HIV, but we're going to keep it from turning into AIDS. Can you tell me a little bit about what you've learned from our conversation?
Not much.
Great. Let me walk you out, make you up a follow-up appointment, and remember, the best way to avoid complications is to take your HIV medication every day and keep your medical appointments. You're not alone. Your care team is here for you every step of the way.
Thank you so much.
You're welcome.
So